Welcome, everybody, to another episode of the From Adversity to Abundance podcast. I am your host, Jamie Bateman, and I'm pumped today to have with us Danielle Fette. Danielle, how are you doing today?
I'm great. I'm excited to talk.
Awesome. Yeah, this is going to be fun. Danielle is the co-founder and chief marketing officer of Fettech, and Fettech is a regenerative medical company. Correct me if I say anything wrong,
No, you're doing
Danielle.
great.
So briefly for the listener who may be unfamiliar with you, who are you and what are you up to today?
I'm a wound care nurse by trade, and I co-founded Fettech with my husband, who is a tissue engineer. I have a pretty strong background in medical device, biotech, regenerative medicine, and we discovered ways to advance regenerative medicine by inventing new devices that they use in the hospital throughout the country. And we just launched a product for aesthetics. So we basically manufacture and develop technology that other people sell in the field.
Got it. Awesome. Yeah, we were chatting briefly beforehand, and I'm really excited to get into more specifics later as far as um, where some of the issues that are found among the traditional medical system, which has some serious flaws. Let's just be real, right?
Yeah.
So I'm excited to get into kind of that part of your journey and why you went the direction you did. But before we get there, I know you've dealt with a lot of personal adversity. Let's jump back into your backstory. Where do you want to start?
Well, it's easiest to start at why I'm in healthcare. So from the time I can remember growing up, I was obsessed with all things medicine. If someone else would fall and get hurt or was sick, or even if there was vomit, I would genuinely want to help. And I noticed I was different early on because other kids and other humans would be squeamish or want to run away from that. So I had a strong burning desire to help people heal from the time I can remember. And I used to tell people I wanted to be a doctor when I was like 3, 4, 5, 6. However, I'm dyslexic. So reading and writing is extremely hard for me. And I struggled in school. I mean, getting a C was like a bonus. On a good day, I would get a C. Um, I luckily played lacrosse and I excelled as an athlete. So that got me into college. And then in college, I was like, okay, let's keep it real here, Danielle. You may think you're majoring in biology or claiming to be a pre med major and sometimes cheating on tests to pass, but you're never going to get into med school or any of the other schools like chiropractic, PT. I explored everything. So I did get into a nursing program. And through doing my rounds in the hospital, I liked helping the patients, but there were so many elements to traditional medicine that I felt handcuffed. I felt like I couldn't use my creative juices. I feel like I couldn't give enough time to patients. So the fit wasn't right for me to be a floor nurse. I switched over to the medical device biotech side and I jumped around quite a bit through sales and marketing and clinical specialist roles where I was in the OR teaching surgeons how to use the most cutting edge technology. And that to me was very rewarding. I felt important in these roles.
Mm-hmm.
So, for example, a neurosurgeon, they would put a pacemaker and the leads would go into the brain and surgery. And I was the one teaching them how to use the new technology that was not available when they were in med school.
Mm.
And I learned working for other people what I loved and admired in leaders and what I absolutely hated and would never be like as a leader.
Mm.
I saw very ugly behaviors, which shocked me because, I know a lot of humans operate from a place of wanting to make money, but when it's healthcare, I mean, we're all going to be patients one day. And really early on, I was shocked by the
Mm.
behaviors I was seeing behind the scenes working for others. It was all about the money. And it
Mm.
really was never, even if they claimed, oh, it's about patients, we care about patients. I'm like,
Mm-hmm.
bullshit. It's not, excuse my French, but I'm
Yeah.
like, it's not about the patients. And I get really passionate and worked up. So I job hopped from company
Mm-hmm.
to company thinking that things would be different. And regardless if it was the biggest Fortune 500 company or a startup medical device company, I saw the same behaviors.
Mm.
I then explored entrepreneurship. There was a time like the online boom of the internet. My sister and I had a clothing store, an online boutique, and that was really exciting because I got to learn behind the scenes how to build websites and sell products. Again, it was the boom of the internet. And at
Sure.
that same time, I also got into real estate, which I'm mentioning because I know you focus
Yeah,
on that on your podcast.
absolutely. Yeah.
I still held on to my solid career in medical device, but I'm pretty good at getting things done
Mm-hmm.
in less time and a lot less steps than my peers. So I was
Gotcha.
able to do both. I was able to be the lead salesperson and make great commissions working for others. And then behind the scenes, I was able to work with my sister, run a company, and also dabble in real estate, which I actually loved real estate.
Nice. Yeah, let's before we get there, because I definitely want to dive into that a little bit. So dyslexia, I mean, I think that's one of those, sort of misunderstood, not sort of, very misunderstood um, challenges. I don't know if you refer to it as a disorder, condition, but what I guess, and many people maybe already know this, but what is dyslexia, and what is it really? How does it actually come to fruition in everyday life?
Well, just picture being in a classroom and knowing how smart you are, like so clever, you could figure anything out. And you were
Hmm.
typically like leaps and bounds. Like if there was a street, you were at the end of the street mentally before
Mm,
people could even figure out how to take a couple steps.
okay.
However, you always felt stupid because teachers would say to you, are you trying? Like, why are you scoring so low if you're so
Mm,
smart? And I can memorize anything. So maybe it didn't sound like I was reading, but when the teacher would call on kids to read in class, I was smart enough to be like, okay, 10 paragraphs down is going to be my turn because I'm looking at the patterns of when she's going from kid to kid. So I'm going to
yeah,
memorize this by the time it gets to me, not focusing on anything else, but memorizing those three lines.
I
So
see.
you
Yep.
become very strategic and very smart, but it is hard because it is embarrassing to
Yeah.
know how intelligent you are. But when we
Right.
went to Juliet and I, who was on your show, we went to the
Yeah.
same high school. It was a very predominant, like education was everything. I mean, all my friends were going like Ivy League for the most part, and
Yeah.
so it was hard and embarrassing not being able to
Yeah.
get those grades. And there were times like you pretend you don't care, but of course it's like, "Ah, this stinks."
Right.
However, I didn't feel badly about myself. I just was embarrassed in those moments because I knew how smart I was, and I had to rely on how creative I was to get ahead. I had
Well, I
to
think
use
that's,
my
yeah.
ability to build relationships, to
Hmm.
strategically do things faster than everyone so they
Yeah.
couldn't find me out. I had to get creative. I mean, I played lacrosse, that got me into college, but once I was in
Right.
college, I didn't qualify to get in the nursing program, but I figured out how to backdoor into it. Medical
Yeah.
device. I was told, you're never going to get this job. You have no experience. These people in the waiting room have, 10 years experience, and you're this young kid right out of school. I'm like, watch me. And I talked my way into the job, with Eli Lilly right out of college. So I'm proud that I have these superpowers, if you will, to get
Yeah.
creative
Right.
and to not be afraid of failing. I'm so
Yeah.
used to failing growing up. It's all
Sure.
how it's on what you do
That's
about it,
critical.
right? It's all
Yeah.
how you pivot. And pivoting is so huge
Yeah.
in
Yeah.
everyday life. So if you
Absolutely.
can identify, this doesn't feel right, not the
Yeah.
best path to go down, and the
Right.
the quicker you pivot and make a change, the better and faster your result is going to be. And I've always had to do that.
Yeah, I love that. And there's so much there that there's a lot to unpack there. There's a, absolutely figuring out, especially for entrepreneurs, whether a real estate entrepreneur or not, figuring out when to pivot and when to hold, stay the course, or maybe just slightly, move off course a little bit to still reach your goals. That is one of those never ending challenges, those tensions that just never goes away. Because if you pivot every day, pull a 90 degree or 180, you're never going to get anywhere, right? But if you're just stubborn, like, just I am set on this for years and years, you're not listening, you're not taking into account market conditions or anything else, you're also not going to be successful that way. So, but I love several things you said. First off, when you said that, um, that you were embarrassed, and you kind of implied that back in school that the teachers viewed you as, well, you said stupid, right? Um, and I recall, so this is not, I don't think nearly, it's not anywhere as challenging as being dyslexic, but I'm colorblind, right? And so I know I have a blue shirt on. No, I'm kidding. But that's what happens is people always ask, "What's this color?" I remember back in, I think it was first grade, but it was definitely elementary school. We had to go do the vision testing at school, and I remember the nurse, or I think it was a nurse, giving the test, and she was just, had done a bunch of them, tired of the test, whatever, and she says, it was that, I think it's called the Ishira test or something, I don't know how you say it, but the dots that you're supposed to pick out numbers and letters based on the colors. Well, I couldn't see anything. She would say, okay, what letter do you see? And I would just see dots. And I'm just like, I don't know what you're talking about. What do you, and so it was, I mean, it was kind of traumatic because it's like she's insinuating that I'm being difficult or, um, just answer the question so I can get to my next person here. And it's like,
Exactly.
well, no, I don't, I am smart, but I don't see a number or a letter. So like, I don't know what you're
You
talking
don't
about.
know that there's anything different. It's the way people
No,
make you feel, and you have no
exactly.
control over it,
Correct.
which is really interesting. But, my mom used to say, in life, you're all dealt over and over again a hand of cards, and it's how you
Yeah,
play those cards. It's what you do with that hand.
absolutely.
And I think a lot of entrepreneurs, whether it's real estate or other businesses, they get so emotionally attached, like you said,
Mm,
and it's important to know when to put them down and move on
yeah,
that hand. And
absolutely.
I think I'm really good at that
Yeah,
because I don't have attachment to situations like,
sure.
and I think that stems from the dyslexia and being
Yeah,
okay with sucking at something, but
right.
also
Right.
having the confidence. Like, if I want to learn something and be good at
Yeah.
something, I know how to do it.
Yeah, no, I love that. And real quickly, before because I definitely want to get into the rest of your story because I know it's fascinating. I remember I saw a recent clip. It was Grant Cardone, who's a real estate entrepreneur, real estate investor, and controversial guy. But he had a clip and I think it was specifically about dyslexia, and it may have been also about anxiety and some other, mental health conditions. But the fact is that entrepreneurs have a higher level of mental health and other similar type of challenges or conditions that the broader population doesn't necessarily have. And you can get into all kinds of debates about, does entrepreneurship cause mental health challenges? Well, maybe. I mean, it's definitely not easy, right? But I think so. His point, and I think he's spot on, was that because Danielle has overcome, in your case, dyslexia, or at least dealt with that head on and figured out how to still be successful and to pivot and use your relationships and your creativity, as you've already talked about, to focus on your strengths and figure out a way to make it work because you've already overcome that. You've built that mental capacity and that strength because you have had that adversity. Now, these challenges that come along with entrepreneurship, you're able to navigate probably better than the straight A student who doesn't have dyslexia. What do you say
Yes,
about that?
a million percent. And I also think a huge part is I don't have an ego. I have
Mm,
had to rely on my resources to get me. Like, I'm not I don't really go deep into any subject, but I have a
hmm
lot of I have enough knowledge to be
hmm
successful in a lot of different traits. But I always know when I have a lot of self-awareness. So I know
hmm
when I don't know something, and I know when I need help, and I know the resources to go to get to where I need to be. So, like, my team, like, I surround myself with amazing humans that are all very unique and bring different skill sets to the table. Where I've seen leaders where that intimidates. They don't want people that are better than them in certain areas, where I welcome it, love it. That's how I got through chemistry lab. I always made sure I
Mm.
had better partners than myself. So again, it just I feel badly for kids sometimes that do really well in school and parents tell them how great they are and they're people pleasers. And then when they get older, what's going to happen? Because you're not always perfect and you need to learn how to say, I'm not sure, but I'm going to go and get the help I need. And that it's crucial
Absolutely.
to being good in business.
Totally. And then the fact is, the education system, in large part, especially on the public side, is just archaic, and it's set up to train kids to work in a factory or manufacturing and that kind of thing. And it's, I think, slowly coming along, but a lot of great people in the education system, but the system itself does not set you up well to be an entrepreneur. So, and I love the you've touched on this a couple of times, but the what you learned from seeing other leaders and what you did and didn't like in that regard, and the fact that the medical system in particular is set up for profit first, and there's nothing wrong with making a profit. I know, entrepreneurs want to make a profit, and we should want to make a profit, right? But if you end up putting that above other people, the patient's health, for example, that's not okay. So I guess before we move into the real estate thing, what were like one or two examples that were really disheartening for you in the medical field with regard to, profit first? We don't have to name names, of course, but what comes to mind?
I mean, I can give you little examples because bigger companies are very narrow minded on what's going to give me the maximum revenue. So we had a product that you used in the body that would signal to heal and repair. And I wanted to use it for nipple reconstruction post mastectomy.
Okay.
But if you think about the size of a nipple, it's really small. And it's very important for women that have mastectomies. So think about a nipple compared to like a huge open stomach, for example. If you sold product, the same product for a huge open stomach, you're going to make more revenue than a tiny nipple. But for me, I'm like, we're all going to be patients one day and someone's
Mm,
going to need help. And that's someone's mom and sister. And if we can develop a device that can help that person feel more comfortable in their own skin, like why wouldn't we do it? But it was all about money.
mm,
And then the icing on the cake for me and why I formed our company with my husband, Fettech, was we were working for another company and they knew that they were making product that could potentially not be good used on patients, but they didn't want to throw away the product. And
mm,
I'm like, okay,
mm-hmm,
my husband and I are like, we don't stand for this. Like, we are done. Like, because the company at the time wanted a quick cash exit. They were a startup
mm-hmm,
company and they wanted as much revenue as possible so they could sell the company, cash out, move
mm-hmm,
on. And, when you see things like that, at the time I was working with a neonate in the hospital, treating them for a massive infection. I'm like, I'm putting this product in them, like even knowing what goes on behind the scenes,
mm,
it was so scary to me. So for my husband and I, we knew we could develop better products. We know we could cut through the red tape to get them to the patients that needed these products faster.
mm-hmm,
And we wanted to do things for the right reasons because I believe if you have a passion and you have a
mm-hmm.
purpose, you can make money and still do the right thing. We always knew that we knew
Absolutely.
our product was amazing. So we knew the money would be there, but that's not what drove us to want to start our company. We just
Mm-hmm,
wanted to take off the handcuffs and not answer to other people because there's nothing worse than knowing you have a better idea or you can do things better. And then
mm-hmm.
the layers of tape kick in and you can't get creative and you can't execute your vision the way you want to. You're answering to
Yeah,
other people. So when we
absolutely.
started our company, we chose to do it the really hard way. We didn't take outside funding. We had people
Mm,
that
mm-hmm,
wanted to give us funding, but I'm like, I'm not selling my soul to the devil because that's what's
mm-hmm,
wrong with the companies we've worked for.
mm,
They got outside funding, they answered to a board and they wanted a quick exit. I mean, my husband and I were very aligned with morals
mm-hmm,
and values. And we're like, we're going to do this our way. So, and that was just a confidence that I had in both myself and Clay,
mm-hmm.
my husband, to develop the best products out there. So there were times, I mean, really talk about like hitting ground zero, no
Yeah.
money, car repoed, house was in foreclosure, robbing Peter to pay Paul just to get all the tests that you need to get FDA clearance. But there was a period of time where, I had done really well in my life. I had,
Mm-hmm,
real estate and other businesses and had a
mm-hmm,
huge cushion working for other people. I was paid very well working in biotech and medical device.
mm-hmm.
And my husband was home in the lab, and all the money we made went into getting FDA clearance.
Mm.
So you
Wow.
can imagine, I mean, we went from like riches to rags pretty quickly. My poor oldest daughter now is like, gosh, I grew up way differently than my youngest now
Huh.
is growing up
Okay.
just because the worlds were so different.
Sure. So, and briefly, what was the real estate? Were you doing real estate sales, or what should you do on the side for that?
Yes. So I had saved money as a medical device exec and having my own business with my sister. And I'm like, where do I want to get into to invest my money? And I
Mm-hmm,
have always liked real estate. My parents used to flip real estate
mm-hmm.
as a side gig growing up. I mean, I remember going and scrubbing cockroaches with my mom when I was really
Oh,
young
wow.
and then flipping these really gross houses, but they made great profit on it. When I moved after going to University of Delaware to Florida, at the time, real estate was still affordable. And I just
Mm-hmm,
saw projections and plans for downtown Fort Lauderdale. And I'm like, I wanted in on it. So I would do a couple things. I would get in with the developers and buy pre-construction and flip it before I moved in because there were some, I don't know, I know every state's
mm-hmm.
different, but
Yeah.
depending on the developers I would work with, because I was friends with them, they would give me first rights and you could flip it once before it was
Mm,
actually ever closed on. So I did
Okay.
that. And then there were a couple other properties I wanted to hold on longer to because I
Mm,
knew the projections of building downtown. So I would hold on
mhm,
to them, rent. But this was like 2004 to 2009. And
mhm.
for those of you in real estate
Yeah.
know, the
Yeah.
market definitely took a turn starting in 2007. So I
Yeah.
got to experience short sales and foreclosures and stuff like
Mm,
that.
gotcha.
I'm very grateful that that happened in
Mm,
retrospect because that kind of made me stay in medical device, which is my
sure.
passion. Helping people heal really is my passion and is my gift. I just didn't know how to combine my entrepreneurial creative side
Mm.
with the healthcare wanting to help patients heal kind of
Got
thing.
it. No, that makes a lot of sense, and that's I'm guessing took a little bit of time to view it that way. Just based on my own experience, it's hard to see, you know, adversity as a blessing in the moment. Um, so if you're experiencing the wrong side of a foreclosure or short sale, it's not fun, right? And so it's but in hindsight, you're saying that you're now able to focus on your gifts and your experience, and really your passion is really what you're talking about. Your passion
Hmm.
to help people through medical devices and help people on the health side of things, and incorporate your entrepreneurial passion and drive there. So, um, okay, so uh, you and your husband decide to start Fettech, right? Is that how it went, or did you?
Yeah, so I
What
met
did that
him in
look
the
like?
field. I was actually in a head-on drunk driving accident at 3 in the afternoon, and I was on leave. And someone called me from a local hospital that I lived a couple miles from and said, "We have a patient with this rare disease where the skin attacks itself and nothing's helping this patient heal." Little did I know that patient was a friend of mine, but I didn't know at the time I
Wow.
offered to help. And I had called the company that made the product, and my husband was one of the developers of this product. They licensed it out to our company and we sold it. I'm like, is there anyone in Florida that can help us? Because, the company at the time was in Chicago and the other branch was in Maryland. And they sent him down and he walked into the room. And I was very intrigued by his lack of ego, but his level of intelligence to speak at
Mm,
every level. And together we helped this patient. And it was strictly a friendship. He was actually married at the time.
mm.
Um, but it was just really refreshing. You always get nervous when you have someone from corporate fly to the field. I'm like, oh, here we go
Sure.
again. You're just going to pitch your
Right.
product, and I just want to help this darn
Right.
patient.
Right. I'm gonna see your ego is gonna be so overkill, and right, but that's
Yeah.
not what happened.
Yes,
Yeah.
exactly. So we worked together, and we would, while we were waiting in the hospital for various surgeons or opportunities to help people, we would brainstorm, and we realized early on we saw things eye to eye. We saw how we could take the products he was developing and use them in different therapeutic areas in the hospital. And we grew the company by leaps and bounds just by collaborating. And he was like a
Mm,
magician. Like I would have ideas and then he would go into the lab and like create the
hmm.
changes needed. I'm like, this is crazy. Like I have
That's
visions,
awesome.
he has visions, and then I have someone that can actually produce
Implement
what
it.
I'm thinking of. So
Yeah.
at the time, like I said, I was on leave because I was in an accident. I couldn't
Hmm.
drive. Um, Clay actually moved. He's a Midwest nice guy who moved to Fort Lauderdale because his wife at the time had mental illness. And
Hmm.
I met him, and my sister and I are like inseparably codependent and close.
Hmm.
And she's a family therapist in child development. And I
Hmm.
remember Clay saying to me, "Hey, listen, I need to tell you the truth. Like, I don't know anyone in Florida. My wife has mental illness and she has
Hmm.
tried to take her life before. And God forbid I
Hmm.
ever need you. I have a 9-year-old. Could you and your sister help out?" And at this
Hmm.
time, we were single in Fort Lauderdale. I mean, I was in the prime of I'm never getting married. I go out way too much and have too much of
Right.
a social life.
And
And
and I can say, by the way, we went to Fort Lauderdale in December, and there's definitely a party
I mean,
atmosphere
I lived at the
downtown.
party. I mean, my life was a big party. I don't know how I did yoga. I didn't sleep. I went from my clothing boutique to fashion shows to going out and
Yeah,
had no urge
gotcha.
to commit to in a relationship. So
Got it.
anyway, you know, a couple months after meeting Clay, I we found out that his wife took her life and
Wow.
he had to travel for work. So my sister and I moved into his house. And I don't think I've ever said this on a podcast, but we moved into his house. And, a couple months in, we realized we had a connection that was undeniable. But I hid it from everyone because I was actually embarrassed because his wife, I loved
Mm,
her. I knew her. I mean,
mm,
I loved who the person that she was. I knew her. We didn't have like a close relationship because I
mhm,
just met them. But I also fell in love with his daughter, who I've
mm,
since adopted and is now my
mm.
24-year-old. But
Wow.
it it is a beautiful love story in a sense. It's like clearly someone wanted my husband and I to get together for the better
Mm,
good of humanity. Because
mhm,
this, if you had asked me when I met him if this is someone I would date or ever marry, I'd be like, there's no way. But I kind of fell in love with his daughter through helping take care of her, and then there was an undeniable connection that we had.
mm.
So after a year of being together, we actually moved to Maryland for this company, left my
Okay.
family, and that's we helped develop their products, and we had stock options, and we believed so deeply in that company. 2 years after moving, I got pregnant. This is when we discovered that the product wasn't good, we shouldn't sell it, and my
Mm.
husband
Uh-huh.
wouldn't sign off on it. So upon having a baby, we were both fired. We were out of jobs, living in
Wow. So
Maryland.
just to clarify, and I don't know if you can say more specifically, but it's not so much that the product might not have benefits, but this you actually saw that there was clear potential downside for
I
patients.
believe, I know it's a legal thing people
Yeah,
can
yeah,
Google, but I
yeah.
don't know what I can and cannot say, but we had a strong belief that it wasn't the right thing to do, was to sign off on it.
Got it. Understood.
Yeah.
Okay, so you both you you got pregnant and then you both got
So
fired from your job,
we were
right?
the month I had my youngest daughter, we were
Hmm.
both out of jobs.
Got it.
Luckily, sales marketing, I can get a job anywhere. I mean, it,
Sure.
but
Yeah,
my
yeah.
husband is one of 5 tissue engineers that develop devices in regenerative
Hmm.
medicine. I mean, there's really not
Yeah,
many of him in the world.
sure.
So we said, you know what? This is our sign. We're going to do it ourselves. We're going to develop better products because you
Hmm.
know how. And he's had these visions, and we've been up
Hmm.
brainstorming. We were just going to do them with this other company because we believed in the
Hmm.
company, and we're pretty loyal.
Yeah.
I think this is our opportunity. And so I went to work. He stayed in the lab. We moved back to Florida. And now here we are today with 2 FDA cleared products. We've used our products on thousands of patients. And time again, we see miracles because patients that ordinarily would have trouble healing or would take a really long time, pain and
Hmm.
suffering, whether it's a patient that's been in a fire, a traumatic car accident, a chronic wound. I pinch myself in gratitude. I say that on every podcast because it never
It's
gets old when you get
awesome.
a patient to hug and kiss you and say, I don't know what I would do without you.
Hmm.
This stuff really is magic. You saved my leg, or you saved my life, or you saved my baby. I mean, I've saved humans before. So that feeling is what motivates me
It's
every
amazing.
day,
Yeah.
but it also keeps me up at night. And I've had to learn to balance my mental health and really learn to listen to my emotions to guide me
Mm.
through life because this is greater than me. I mean, at some
Mm.
point you talk about it and it feels surreal, and you say to yourself, okay, if this is my purpose,
Yeah.
like the fact we figured out how to do this and the fact we're able to help people restore where there's injury in their body means I have to rely and trust that there's something greater than me out there, wherever you want to call it or whatever you believe in.
Yeah.
And I've really had to check how my head feels versus like my gut intuition to get
Mm.
through and make better business decisions.
Interesting. So is there, I mean, that makes sense, but do you have kind of an example of what you mean by that?
Yeah, I mean, okay, so there's a lot of times on paper that a transaction or a deal would be like, wow, that seems like
Makes
a great
sense.
opportunity. This person
It
on
pencils out.
paper,
Yeah, on paper.
like it
Yeah.
checks out, like we could
Yeah.
make money and this is an opportunity, but something
Sure.
deep inside myself is not excited to do it.
Mm.
And I
Yeah.
can't identify why. Like, I'm like, there's no logical reason behind this, but something inside, like, I'm not really quick to want to pick up the pen and get excited and go to dinner with this person. I should be excited to go have dinner. I should be
Hmm.
excited for this meeting. Everyone's
Yeah.
told me this person's the biggest thing since sliced bread, but I don't know why. I have no motivation. And then I have to remind myself, Danielle, it's not because you're lazy. It's not because you're not hungry. Listen to these
Hmm.
emotions. And my sister
Hmm.
has really installed upon me because I am a very impulsive person. I like things yesterday and I don't like to wait.
Yeah.
But I've had to learn that if I'm not excited about a decision, to pause, and I don't have to feel like I have to make a decision.
Mm.
And
It's good.
making no decision is better than making a decision and have to backpedal out of it. because that's where you lose momentum and time as an entrepreneur and in
Mm,
business. You make a couple bad business decisions and you wake up really quickly and say, what can I learn here from this? And how do I not do this again? And for
sure.
me, it was making a couple mistakes. And I'm like, this cost me time and money and emotional stress. Like I get attached
Totally.
to people. So if relationships don't work out, whether it's business or personal,
Yeah,
it eats away at me. And I
for
can't
sure.
have that if I want to be successful and help heal a lot of people.
Mm,
So I thought, okay, I had signs, I had warnings. I don't know about this. And I went through with it anyway. So I've had
hmm.
to really like tap into those emotions and
Got
pay
it.
attention. Again, you
Yeah.
may not
Yeah.
know
Yeah.
the answer. You don't need to
Right.
know the answer and you don't need to know the why. But if something doesn't really light you up and excite you, pause
Sure.
and do nothing. Don't act on it.
I
And
love
then the
that.
answer will come.
That's great. And you're absolutely right. I mean, I have that same type of as an entrepreneur, the same impatient drive. I mean, I want to see results immediately. The risk for me ends up being making bad decisions, you know, because I'm impatient, or doing too many things, and therefore not doing anything well, doing everything on an average or, you know, B plus level or something, instead of focusing. And so that's something that I think I need to hear over and over again, as well as what you just said, is lining up. Yeah, it should pencil out. There should be the logical piece that it makes sense, of course, right? But even more importantly, tapping into that intuition and pausing, like you said, that's what just pausing to make a decision. You don't almost nothing is actually on fire and has to be done immediately. So if you can pause, think about it for a day or two or a week or whatever, create that mental space to make a more informed and take that time to tie into your emotion, like you said, and make a better decision.
Right. And the reason why I say emotion is because it's easy to get in your own head and to
Mm,
justify or to talk to too many people that are going to
mm.
justify the decision that you ultimately want to make. And I used to do that. I used to let
Right.
me talk through this situation because the truth is, I know I should probably do it, but I have hesitation. So maybe all these other people can convince me, like, no, I should do that.
Mm.
Instead,
Sure.
now I pause. I'm like, okay, why do I have any hesitation? And if I feel the need to talk to someone else to justify the decision, I need to pause. And
Mm.
I stop trying to figure out the why behind
Hmm.
it,
Hmm.
and be okay with some things you're not supposed to know.
Not
One
gonna
day I'll
know.
look back and I'll know this is why it unfolded. Oh, that's why I
Sure.
didn't want to use that speaker. Oh, that's why I
Yeah.
didn't want to sign that license deal. It
Hmm.
doesn't need to make sense in the moment.
Got it. That's good. That's really good. Okay, before we get into, I want to drill into the products, the two products you have. But before we get there, you mentioned, okay, you were doing really well financially, and then you and your husband were struggling financially because you put all the money into the FDA approvals, I believe. What did that look like from a personal and family standpoint? You know, where were you before, and how many years were you living in, you know, was it bankruptcy, poverty? You know, what did it look
I mean,
like?
we had our house, but there were times where in Florida, I felt like education because my daughter also has dyslexia. So going to a
Mm,
private school to me was like top tier,
mm-hmm,
like
mm-hmm,
priority. But there were times I'm like, what do I do? Pull her out of school, or like they're going to come repo my car, which was
mm,
embarrassing because, like I lived in a nice
sure.
neighborhood and, it was on Zillow that my house was in pre foreclosure. And I know
Mm,
friends were talking about it. And it was interesting to see people view me differently because they thought I had less than them,
mm,
which is like, I was okay and comfortable because I knew at the long run how well we
yeah,
would do. And we made this choice. We could have taken funding, like I said
sure.
earlier, but we didn't
Right,
want
right.
to. But it was hard because it takes about 5-6 years. So you're talk about a marathon
Hmm.
and not a
Yeah.
race. And you have to be patient because you have to do more tests. And just when you think you're close, the FDA may say, hey, we need this one more safety test, or we need this one more clinical evaluation. And that's,
Hmm.
$100,000. And it,
Wow.
we spent millions. I mean, our life savings went into this project. But again, we
Wow.
just had faith and we knew where
Yeah.
we wanted to be and why. And luckily we
Yeah.
had supportive family. So there were times we'd have
Mm.
to call like a brother-in-law and be like, hey, can you lend us
Right.
$50,000 so I can not lose my house this month?
Yeah. Right. Wow.
Hurricane happened. That helped a lot with real estate because you can get
Mm.
a forbearance on your mortgage. So,
Mm. Yeah.
you
Yeah.
know, things
Sure.
that most people would probably cry over, we were excited that helped us
Yeah.
get
Well,
through
there's always every problem brings an opportunity, right? Or, you know,
for
something that
sure.
is a plus that wasn't there before. Um, so okay, All right, let's talk about the two products. I mean, what are the products that you offer? How do they actually help people?
Yeah. So my husband's a tissue engineer, and basically what he takes are elements of tissues, the biomolecules we need to facilitate healing. So in layman's terms, if you're healthy enough to heal, so say Jamie, you cut your finger, your
Yeah.
body would go in through inflammatory response, which is
Hmm.
that redness, that swelling. It's bringing all the biomolecules to the area, and then it's telling it how to heal. But our body's natural reaction is to form scar tissue. And
Hmm.
scarring is really just a way for our bodies to put a quick patch on what's open so we don't
Mm.
get further infection. So the premises behind regenerative medicine, and again, that's if you are healthy enough to heal. If you
Mm.
have a comorbidity, like if you have diabetes or an autoimmune, or
Hmm.
you've just had radiation, and you have cancer, your body naturally won't be able to heal and restore the way someone that doesn't have those comorbidities.
Sure.
Regenerative medicine is, how do we take the best biomolecules that our bodies naturally have
Hmm.
and put them into the injury to tell your body how to repair and remodel differently. So
Mm.
when you take what my husband has made and put it into an injury, it's
Hmm.
going to signal to your body. It's going to say, okay, stem cells, come here. Now, don't go
Hmm.
through inflammatory. So the pain, the redness, that's not happening. And
Hmm.
then no scar tissue. And some patients still have a little bit of something, but
Hmm.
ultimately it's signaling to your body to heal differently. And wherever there's injury in your body, now you're going to repair the
Mm.
injury. And it's pretty wild. It sounds like
Yeah.
sci-fi medicine. We used it. We were cleared topically. So I've helped soldiers that were blown up in war,
Mm.
and their legs were blown up, and we put it on them to heal. Or a patient, instead of needing all these skin grafts after a fire, you can use our material, fill in the area, and then the skin will heal across, and minimal to no scarring. I fell in love with this product. My husband and I were like, okay, how do we take this powder and help all different kind of areas, not just topical, but
Hmm.
if you have traumatic brain injury or spinal cord injury, those are
Hmm.
injuries. What if you have a heart attack and your heart muscle dies? Could we inject our material into the heart to
Mm.
help it function? So we had all these ideas, but we needed to turn the powder into a gel form so that we could
Okay.
inject it.
Uh-huh.
So over COVID, that's what we did. We took the powder, we turned it into a gel. And then somewhere along the line, I realized in the world of aesthetics, our skin is our biggest organ in our body, and it's
Mm.
really important
Hmm.
to take care of it.
Sure.
Side note, even though I come from medicine, I'm actually granola crunch and I love all things natural. So I actually don't agree with conventional medicine. And if it was up to
Yeah.
me, for me and my family, I try to do everything possible to fix, repair, heal naturally before I will rely on
Yeah.
conventional medicine. And I
Well, I
do
think
think
that
there's a time and a place. There's
sure.
a
Right.
blend that has to
Absolutely.
occur, but I
Yeah.
don't look at it all one way or the other. It doesn't have to
I
be just
agree.
Eastern or just Western medicine.
Totally. And I'm by no means an expert, but I've just gotten more and more into I'm working with a nurse practitioner myself right now who is she left the traditional medical field to start, I think about 4 years ago, to start a functional medicine, holistic medicine, whatever you want to call it, practice, because the traditional medical system is so broken, and we do tend to not use our bodies. I mean, it's the most powerful resource we have is the body itself, right? Is just for physical healing. I'm talking about. We tend to not use that and just slap on some external solution that then creates additional side effects and other problems that then you got to go take this other medication for that. And I think I mean, no doubt. I'm just, there are a lot more and more podcasts out there, more and more. I think people are starting to wake up, starting to realize that the system is broken, and that we've got to go in a more natural, holistic way. So I think you're clearly out in front of this curve, and riding the wave, and obviously there's a ton of work. You're not just riding the wave, but I think your timing is fantastic from a market standpoint.
No, it
Anything
really
to
is.
add there?
And like when we started this, I mean, we've been doing this for over 20 years. My husband's
Mm.
been inventing the most predominantly used devices in the hospital he has helped work on, but there wasn't much evolution
Hmm.
in the space because again, the tunnel vision.
Yeah.
So again, we're proud of Fettech because we're advancing it quicker than the other companies can
Mm.
because of our forward thinking mentalities. But I think of it like this: as humans, we thrive in a perfect environment. right? You're surrounded by good people, you feel supported, you feel loved, you're going to do better.
Sure. Absolutely.
So our cells are the same way. Our cells
Yeah.
thrive in the perfect environment. And right
Yeah.
now, we know clinically, there's a lot of talk about biohacking and
Yeah.
again, like how you eat, mental stresses, um, metal toxicity, there, EMF, like there's lighting,
Yep.
there's so many different things
Right.
that contribute to our cells not being healthy. And I think that if our cells are not in the right environment to thrive, disease happens and it presents as cancer and it presents as autoimmune and all these different problems. But no one's talking about, okay, instead of putting a band-aid and masking all that,
Right.
how do we fix and get to the root of the problem?
Yep.
And that's where I'm really excited to explore with our MTP platform. It's a multi-tissue platform is what we developed, because if we can restore and rebalance the environment that the cells are in and then tell those cells what we need to do to repair and balance the body out, that's how we're getting true regenerative healing.
Mm.
So even though we've been using this for 20 some years in the hospital,
Hmm.
now it's exciting because I think humanity's catching up and
Right.
talking about stem cells and talking about alternative ways to heal. So I think it's just a matter of time
Sure.
where this whole thing blows up. The biggest challenge is what the FDA recognizes and wants to accept versus like what doesn't go through the FDA. So when you talk about
Gotcha.
like stem cell, so instead of putting outside stem cells into your body,
Yeah.
which do not go through the FDA clearance and
Okay.
regulatory, our product does go through FDA and regulatory. We're putting all naturally what you have in your body to make your own body stem cells come to the area and then give them the instructions they need to know what to do to repair the injury.
Got it. So both of your products do that. Is that right?
Yeah, it's basically the same exact technology. The
Uh-huh.
first thing we made was a powder, honestly, just because it was easier to make. And then from the powder,
Right.
we turned it into a
Into gel.
gel,
Got
which
it.
took a lot of time to figure out how do you make it into a gel? How do you preserve all the properties of the biomolecules in there? And it's, the science behind it is so fascinating because we think we know, but we're just
Right.
scratching the surface.
So
They're
true.
discovering new biomolecules and peptides and proteins that are in our body like every day behind the scenes.
It's amazing. And I've just because of some family mental health challenges, I've gotten more and more into understanding, learning. There's so much, well, so much I don't know, but I'm starting to appreciate how little it really is known about mental health. And but the fact is, I think it's more and more pointing, the evidence is pointing to the fact that mental health is tied into brain health and physical health, and truly at the cell and mitochondria level, that's all interconnected. And instead we have, I mean, unfortunately I should say, we have these hundreds of specializations in the medical field, right? Nothing wrong with specializations. Obviously your husband is a specialist and super smart in what he does, but it almost feels like it's just so splintered that nobody's bringing it all together, and that's really what's needed here.
Totally. We're all connected. Our bodies are all energy. What happens in your oral health will affect your body. What happens in your gut affects your whole body. And unfortunately, when clinicians are trained, it's very segregated. You learn about you master
Right,
one
right.
body system.
Sure.
And I feel bad for the doctors, to be honest. My
Yeah.
friends that are nurses and doctors, I feel horrible. They only learn a certain way in medical school, which is
Yeah.
dictated by who pays for the books. And they're not taught this whole world. They're not taught to think outside the box. The insurance companies and the hospitals are who's
Yeah.
banking. But as patients, we're frustrated. And then as healthcare providers, we're frustrated. I don't have the
Sure.
answer, but I know
Yeah.
the more I can try to help educate
Yeah.
humans and patients, because we're all going to be patients one day, the more I want people to feel empowered that not anyone has all the answers. And just to really feel comfortable asking questions, asking, why are you using this product over that one? How did you
Right.
come to that decision? What other products would be available for what I have? Because you
Sure.
never know. Like a lot of times, hospitals will only use what's on contract and where they're
Mm.
getting the best deal. Doesn't mean it's the best product available. And
Mm.
the doctor may not be able to use products based on what's not on
Yeah.
formulary. So
There's
there's a
just
lot of things that go into healthcare behind the scenes. I wish it
right.
wasn't that way. You
Right.
know, in your mind, it's like in other businesses, I get it. It's about money, but these are patients' lives. But at the end of the day,
Sure.
it's a business too.
It is, right. And then the fact is, and all this can be so, it can seem very overwhelming, and just like what diet should I do? What medication should I take and all this stuff. But at the end of the day, you do need to take ownership of your own situation and your own health. And I mean, companies like yours are clearly helping people such a positive way. So, um, talk about what specific, I guess, conditions does Fettech address, and what do you not address? You said natural healing and wound healing. What really, who's your ideal avatar client, I guess, of your client?
Well, right now we have the two products we have. We treat the patients in the hospital that have been through burn,
Hmm.
chronic wound, trauma. And now we have the gel, which
Hmm.
will be used in the aesthetic market to strengthen your skin and make it appear younger.
Got it.
We, through getting FDA clearance, we had to prove if our product was infected with virus, how would that transmit to patients? We
Mm,
kept failing this test and we spent hundreds of thousands of dollars to redo it. And then through that, we discovered that our material actually deactivates an envelope virus. And at the time, this was right before COVID. I didn't know
mm.
what an envelope virus was. So
I
I
have no
Googled
idea.
it and I Googled it. It said herpes and shingles. I'm like, great. I do get a fever blister, which is a form of a herpes once a year on my lip,
Mm,
and I will use the product. But
mhm.
at that time, that didn't feel like my life mission. On our whiteboard was like traumatic brain injury, MS, heart attack, like those
Sure.
osteoarthritis. However, then COVID broke out and we Googled envelope virus and we found out that COVID is an envelope virus and
Mm,
some of the
okay.
world's most deadly diseases, not diseases, the hardest viruses to treat, like
Hmm.
HIV, Ebola, Marsburg. So now we're working with the government to do tests. I'm actually leaving for Australia in a couple of days
Okay.
to accompany one of the most world-renowned scientists that's done some awesome research using our material against herpes and shingles. At the time this is going to air, I guess I can say it, but
Hmm.
against Valtrax, she looked at
Okay.
our material and other products on the market used for herpes and shingles. You have to catch it very early within like 3 days, else they don't prevent the spread of herpes and
Mm,
shingles.
hmm.
But also there's toxicity to them and they can't always be used in combination with other therapies. So I'm beyond pumped that our product not only worked, but it worked even if you caught the herpes or shingles later on. And
Mm,
it's all natural. So there's no toxicity, there's no problems. You can use it in conjunction with any other therapies.
mm,
So it's totally groundbreaking.
mm,
But my husband and I laugh, like, I really am a wound and skin expert. Like, I
mm.
know more than most in
Yeah.
that space. And my husband in tissue engineering. However, we know nothing about viruses. So, like, right now, I'm
Mm,
trying to study and read and learn everything there is to know.
hmm.
Fascinated with viruses, but that's like a whole different language to me.
Sure.
Yeah,
Gotcha. Well, and just to point out, that's another example of where you said you had to spend $100,000 or several $100,000 on this testing. So that's bad, right? It could be viewed as
right. At the time, I could have, like,
at
I
the
was like
time,
crying.
right? But it's like you just talked about what the good that came out of that
Correct.
wouldn't have come out of that, and it wouldn't have happened. It sounds like, or you wouldn't have realized how good your product was had you not gone through that adversity with the FDA testing. Hopefully, I
Absolutely.
got that right.
Yeah, you did. You nailed it.
Awesome. All right. So as we start to wrap up here, Danielle, I've got some rapid fire questions. Are you ready?
Sure.
All right. So this one tends to trip people up a little bit. What do people misunderstand about you? You personally?
I think some people in my career have thought I'm too nice and have tried to take advantage,
Mm.
but you push me too far and I'm not messing around. And if you mess with, like, I can endure a lot more individually, but if something crosses the line with my family, my children, or people I care about, I will handle it
Yeah.
very quickly and very effectively. So it's almost like the mama bear claws
I
come
was
out
gonna say Mama
and
Bear
people
comes out.
know, like,
Yeah.
do not cross the line. Like, do not misinterpret my kindness and generosity for stupidity.
Love it. If you could go back and give your 18-year-old self some advice, what would that be?
I would have taught myself to slow down and pause and listen to my
Hmm.
emotions earlier on and stop being so obsessed with needing to figure everything out and be more intrigued with, like, it's okay not to know and the
Yeah.
reasons why it's okay not to know. Just follow the little breadcrumbs, but you don't have to have like the be all and end all answers all at once.
Hmm.
Like, you don't need to know your 5 year plan. You just need to know what feels good and the direction you want to keep walking towards.
Love that. If you were given $10 million tomorrow, doesn't have to be for your business, just personally, what would you do with it?
There's definitely studies that I would fund immediately in cancer research and some other ones to prove, like, proof of concept to move forward
Hmm.
with those projects. I would probably buy property on the beach because it's going quickly, and would plan a reunion with my family, probably like a party, like a vacation
Nice.
party.
Yeah.
Yeah.
Awesome. Um, in your business, what is one challenge that you and your husband are facing right now?
Not enough time in the day.
Mm,
Honestly, I know it sounds
yeah.
so like
No, it's,
cliche,
yeah,
but
I get it.
just we there's so many projects we're working on, from grant writing to government projects, the viral in, Australia,
Mm,
to we just got FDA gel cleared and we're launching in aesthetics. And when you have visions and you believe in your product so much, it's like I just want to help as many people as possible. And that pressure is really hard. It's hard to separate the pressure, knowing people are relying. We get emails morning, noon, night from people like, please, my only hope to live. Or my baby was
wow.
born with an open abdomen. And I heard you did a poster that won years ago and it would heal this. And without you, my baby will die. And then there's politics that, like, I can't just legally ship it to them.
Mm,
I'll go
that's
to
what,
jail and we'll get closed
yeah.
down. And if it's not approved through the political chains of the hospital,
Mm,
even if a doctor wanted to use it, they can't always
mhm.
use it if it's not approved and in
I
network.
see. Yeah, that was, I was curious about that. It's, yeah, I mean, it's, that's what I thought, but I wasn't positive. If somebody just on the street wants to use your product, they can't just contact you and order your product, correct?
No, they would need to get their doctor to like email us that it was okay, and
Hmm.
then we could ship it to the doctor or the patient, but they would need an order. And then the other thing, reimbursement. Oh, if you
Mm,
if you ask me
hmm.
the one thing about healthcare right now, I just want to, like, I could put my
Hmm.
fist through a wall, because you get
Yeah.
FDA approval, which is that's one path you have to take. But to
Hmm.
get reimbursement, that's through CMS, and CMS does not care what the FDA says. So you would think they would be all bundled in one. Like, you get a product, the government says it's good enough to sell, it's good enough to
Yeah.
help people, we're approving it safety wise. But then
Hmm.
you have CMS saying, even though it's so safe, you did all this clinical testing and they're saying it can be used, it doesn't mean we're going to pay for it. So and then you have to pay for a whole nother round of tests and years of testing just to get it reimbursed. So, it goes
Hmm.
back to me now being very educated and knowing there are wonderful products out there that could be available to help people
Hmm.
that are against or not accepted in conventional medicine because they may not be reimbursed yet.
Got it. Yeah, that's a lot of bureaucracy and a lot of red tape. That's very unfortunate. I worked for the federal government for 14 years, so I'm familiar with the many agencies not agreeing on things.
Right.
Unfortunately. Um, all right, what is a book or two that you could recommend for our listeners?
Well, the only time I turn on a book, which I don't read, is to go to bed, and I set my alarm for 5-10 minutes. But I'm really into anything. If I'm not reading journals and scientific literature about regenerative medicine,
Mm,
I will be listening to things that usually like enhance health. So the Cancer Revolution by Dr. Keneally, I'm obsessed with. Whether you have cancer or
okay.
not, it's interesting because it talks about ways to treat and heal patients thinking outside the norm. I love Dr. Jack Cruz. He's a neurosurgeon that, again, is like anti-conventional medicine. And he talks about light and how important, we're, as
Hmm.
patients, trained to be afraid of the sunlight. But
Hmm.
truthfully,
Yeah.
if we act like elephants, he says, and or we're awake in the morning upon sunrise
Hmm.
and sunset, those
Yeah.
rays actually help our skin know how to protect us better against
Mm,
the sunlight. So
got
I'm
it.
obsessed with everything about Jack
Yeah.
Cruz. It's Kruse. Maria
Okay.
Menounos podcast. I'm the biggest Maria Menounos fan. She preaches be the CEO of your own health. She was
Mm,
a TV interviewer. I think she was on like Entertainment Tonight, and she's
mhm,
just a force to be reckoned with because she's so pure and authentic. But she sheds lights on ways that she's had to treat herself from cancer and tumors, and had to take her own health into her own hands as
mm,
someone that was born with type 1 diabetes to do
mm,
better in the world and to help inspire other patients to know it's going to
mhm.
be okay, but let's share the information we're learning. So I
Yeah,
love her podcast.
that's awesome. Yeah, and then on the diabetes thing, even type one, it's I'm people are learning now that it's reversible, right? I mean, and they're not everything that we thought was, um, a lifelong curse has to be that way. And then secondly, on the light thing, I know Andrew Huberman talks about that a lot as far as just, you know, you know, even for optimizing sleep that night. getting up in the morning and having that first light in your eyes can really help set that circadian rhythm, which helps you get a better sleep that night, and then just helps you be your best self, right? To show up
Mhm.
for other people, be the best entrepreneur you
He
can.
actually learned the light story from Dr. Jack Cruz
Is that right?
on his podcast. Yes. So
Gotcha.
definitely check that out.
Got it.
I
Awesome.
think it's like a 3 segment series, but it was
Man.
fabulous. I listened. I mean, it's deep. A lot of it's over my head, and I'm
Hmm.
used to science talk all the
Hmm.
time. But it's
Yeah.
fascinating because we're trained to be afraid of the sun,
Yeah,
but yet
exactly.
most people that develop cancer, like skin cancer, have low levels of vitamin D. So what does that tell you?
Right.
We
They're not
clearly need
out.
the sun.
Sure.
All right.
Absolutely. Awesome. What is one question that I have not asked you that you wish I had?
No, you've done a great job.
We've covered a lot of
Yeah, I
ground.
don't know. You're stumping me here. I think
Awesome.
you've asked me really good stuff.
All right. Danielle Fette, where can our listeners find you online?
Well, you can look up Danielle Fette on LinkedIn. And full disclosure, I laugh because for so many years I was in hiding because I felt guilty not being able to help patients. But now
Mm.
I'm doing more talking about like entrepreneurship and how to
Hmm.
listen to your emotions to guide you through owning a business. And on the aesthetic side, it's a lot easier to talk about because it's a cash business. So I'm not as
Mm.
handcuffed, not
I
being able to
see.
help people in the hospital. So now I'm
Yeah.
coming out of the closet. So you can find me on Instagram, Danielle Fette. Fettech is FETTECH.com. And then if you go to our Fettech page, you can find all our other companies.
Awesome. And Fette is Fette for the
Yes.
listeners. Um, well, the fact that you you're out and about, you're out now, it must mean that you're actually living in your purpose, and you're not, there's a reason you're not hiding anymore, right? Because you're aligned with your mission and your purpose and serving others, which has to just feel so good, even if you're super busy and tired some days, and dealing with all the challenges that come along with entrepreneurship. It definitely, from my perspective, seems like you and your husband are absolutely out there serving people and just living out your purpose. So kudos to you.
Thank you.
And thank you, Danielle, for spending your time with us. This has been great. So really appreciate it.
I appreciate this conversation. It was fun. Thanks.
And to the listener, thank you for spending your most valuable resource, your time and your attention. Those are your quality time. We appreciate that very much. Check out our website, adversity2abundance.com. And we always love 5-star reviews. And more importantly, share this episode with a friend. We appreciate it all. Thank you. Take care.